Friends, welcome to CNS Viewpoint. Today we are going to talk about an important uh, thing. I read a statement from Dr. Soumya Swaminathan. She is the chief scientist of World Health Organization, the United Nations Health Agency. Dr. Swaminathan had said, and it's not verbatim because I'm just telling you the, from what I remember reading it in one of the media, that she basically said that it will be a foolish idea to let the natural infection take its course and people develop immunity that way. And so basically what she said was there is a huge human cost, human suffering, unnecessary, which people will be forced to bear if we let the infection spread. So basically she was cautioning those who are advocating let the infection spread in the population and let people develop natural immunity because of getting infected with coronavirus, and that way they will find a way out of the pandemic due to herd immunity. There is a huge human toll, there is a huge unnecessary human suffering, and maybe untimely deaths, which especially those who are at very high risk of developing serious disease of COVID-19, they will be forced to bear. This is just unimaginable kind of an agony which is totally preventable only if we can roll out vaccines equitably, because the same kind of immunity, similar kind of comparable immunity, comparable protection can be given by vaccines without any human suffering, without the unethical burden of untimely deaths which will happen because of if we let coronavirus infection just spread freely without any control or without any infection control in place. Moreover, it also shows that if we have to fight or decimate, control infectious diseases, we need much stronger health systems in place, and this can't be done overnight. But at the same time, throwing in the towel at this time, when actually this is not the time to throw in the towel, this is the time to accelerate, to strengthen, to firm up the responses to COVID-19. So with the hope that governments will not throw in the towel at this critical juncture, it's more than 2 years now. We have really not done ideally, and we have done very badly actually in terms of COVID response. If you look at the inequitable vaccine rollout, or if you look at the inequitable access to tests or other healthcare services, and how other healthcare services and other social support services got impacted during the pandemic, how profit minting, etc. happened. But coming back to this point, we have not done very well. But can we do better in COVID response and a response to sustainable development? That is the only way out of the pandemic, and at least they help us inch towards, in a more sustainable manner, towards not only addressing the pandemic, but also other development indices which are so important if we are to deal with situations like the COVID-19 has got us in. So with these words, and hoping that governments will value socially just and ecologically sustainable responses to COVID-19, as well as to every other health and development issue, in a very integrated and planned manner, well coordinated manner, with equity and justice in the center. So let me conclude today's CNS Viewpoint, and tomorrow again at 5 p.m. India time, I will be back again with our thoughts and views and perspectives on something that made us think. Bye till then, take care.